Good morning. My name is Charlie Meier. I serve as the Assistant Republican Leader and State Representative for the 109th Districts, with portions of Bond, Clinton, Madison, St. Clair, and Washington counties. I'm here to discuss realistic plan to help make improvements needed to Choate Mental Health and Development Center. It's called Help Protect Us and Improve Our Home. For over 153 years, Choate's mission has been to provide care for our most vulnerable people with mild to profound intellectual disabilities. The suggestions I am about to discuss will help protect current and future residents of Choate, improve the Choate Mental Health and Development Center, and place residents' care in a place the residents call their home, because it is their home. To help protect us and improve our home plan includes 11 ways and improvements for Choate. We are here today because we have a plan and we want to protect these residents. Our first is installing temporary cameras in common areas. There's much debate on this across the state. This is the time and the place for this now. If they need to come out later after we have things improved at Choate, let's discuss it then. But for now, immediately install cameras in common areas. Implement ongoing staff training to include residents' rights, abuse, neglect definitions, reporting per Office of Investigator General, mandatory reporting, and documenting as well. Educate staff on past abuse issues experienced at Choate and train them to be aware of the issues, report incidents, and how to take appropriate action. A mass, and I say a mass hiring of qualified staff. We've done hirings before because of COVID. Bring in a mass hiring so that we have a group of new workers there that won't feel threatened maybe from a few bad apples of the past workers that threaten to try to cover up abuse. Let's train them, let's get them in there. Let's not hire 2 or 4 or 10 at a time. Let's bring in a group of 50 workers or more immediately to help take care of the shortage of workers and to bring some new lifeblood in there and get things turned around. Track staff incidents by location and trends. By using the data collected to implement changes, monitor staff identified in the tracking, and incorporate supervisory management staff to increase overall observances. Number 5, increase administrative and security inspections. The center director and assistant center director, along with other professional staff, must unannounced visits on all 3 shifts. Morning, noon, Saturdays, Sundays, 4 in the morning, 2 in the morning. This is their job. This is what they're being paid for. They need to be out there walking the halls, seeing their residents, and should be, after a short while, on a first-name basis with them. Security staff must report all incidents of improper behavior. Any staff who bullies or intimidates or threatens residents or other staff should be immediately removed from their job station. There must be 0 tolerance of staff intimidating other staff or residents. 6, improve overall accountability of staff performance to include job duties, Office of Investigator General reporting, active treatment and adherence of policies and procedures. This would require accountability from the administration and the professional staff. 7, remind employees, if they see something is wrong, report it. Employees are mandated reporters. Their position is protected under the Whistleblower Act. They don't have to be revealed who released this, but they need to report it. Too much is going on unreported. Increase the amount of active treatment and activities for the residents. Why? Because individuals who are busy and active have much fewer behavior issues, which should lead to less negative interaction with staff and individuals. And if additional activity staff is needed, then hire them. 9, encourage and welcome parents, guardians, and visiting their loved ones by telling them be in there. They shouldn't have to call or set up a time when they're coming. These are their loved ones. They should be able to visit their family members in their family member's home whenever they want. Encourage more groups like the grandparents groups, where individuals come and adopt a resident there and act as a grandparent to them. So we have more oversight going in there, more people around to be seen. Staff should continually be reminded that Choate is home for these individuals, and they should be treated with respect and dignity. Encourage the decorating of the hallways and rooms. This is a small thing, but the more the homes are clean, well decorated, welcoming, the more the staff and residents take pride in their home. Designate a specific phone line for guardians and families to contact that is available all hours and does not go unanswered for days when they're trying to get a hold of their loved one or tell them that there's been a medical change that their doctor wants. You should have somebody answering that phone line 24/7. Assign an intern director or assistant director to Choate Development Center. This director should be someone who has previously supervised employees at another center and is well trained on state rules, regulations, and expectations. This interim director can monitor and help retrain the present director and assistant director. Reevaluate the Office of Inspector General reporting systems as it currently operates. Staff who are mandated reporters are not protected or kept anonymous during investigation process. This turns into cases hesitancy in reporting. The OIG involvement in allegations needs more protection for the employees and the investigators, and they need to happen within a month. We have investigations that don't start till 9 or 13 months later. These employees are placed on paid leave. The state of Illinois is paying for them. They're not working, and we're not finding out what happened to these residents. Put a person in there permanently from the office and let them start and get these investigations done within a month. If they're found guilty, they need to be fired immediately. There's a couple bills that have been introduced, and there's a couple amendments that have been added to them that are not listed yet. They're bills that I've worked on for several years trying to promote things. House Bill 1298 about unannounced visits, House Bill 2998 about the surveillance cameras, and House Bill 3545, which is about background checks and the reporting time that it takes. So these are all bills that may have an amendment to make it a little more specific for Choate that doesn't show up yet, but the amendments are done and they're ready to be filed if we can get these bills to committee. In closing, the Help Protect Us and Improve Our Home proposal is a realistic plan to help make the improvements needed at Choate Mental Health and Development Center. A place our residents call their home. I am more than willing to work with DHS and the elected officials to help foster a safe, loving, healthy home where they can happily live their fulfilling lives.